Today, we're going to talk about something pretty incredible. We're going to get into the story of how medicine figured out how to control one of the body's most powerful, most primal systems, that whole fight-or-flight response. It's all about finding the biological brake pedal and the off switches that keep our internal engines from completely redlining.
So let's just start with a thought experiment. What if you, personally, had a little dial for your own stress response? The ability to just reach over and turn it down whenever it's running a little too hot. Well, that's not science fiction. It's actually the core idea behind two really revolutionary classes of drugs.
All right, let's get into it. To really wrap our heads around the solution, we've got to understand the problem first. And that problem? It all starts with our body's built-in overdrive button, the sympathetic nervous system, which you probably know better as our fight-or-flight response.
The easiest way to think about it is like a gas pedal. It's fantastic in an emergency, right? It gives you that massive jolt of adrenaline you need to deal with a threat. But for millions and millions of people, that gas pedal basically gets stuck in the on position. And the results? We're talking chronic high blood pressure, a heart that's just working way, way too hard, and all the long-term damage that comes with it. So if the big problem is a stuck gas pedal, well, the solution seems kind of obvious, doesn't it? You need a brake. And in the world of medicine, one of the most important braking systems we have comes from a class of drugs called beta blockers. So here's the key. A beta blocker is basically a molecule that's designed to do one thing, and do it really well: get in the way. It physically blocks stress hormones like adrenaline from screaming their "go faster" message at your heart. It is, and this isn't even really a metaphor, a biological brake pedal for your entire cardiovascular system. And what's so cool about this is just how simple and honestly how elegant the whole mechanism is. So step one, adrenaline or stress hormone is racing towards a receptor on a heart cell. Step two, the beta blocker molecule, which is perfectly shaped to fit that same receptor, just gets there a split second earlier and parks itself in the spot. And step three, adrenaline shows up, but it's too late. The parking spot's taken. The message never gets delivered. The overdrive signal just stops, dead in its tracks. And the result of this is exactly what you'd hope for. With those brakes applied, the heart just chills out. The heart rate slows down. That's what doctors call a negative chronotropic effect. The contractions themselves become less forceful. That's the inotropic effect. And even the electrical signals that keep the whole thing beating in rhythm get smoother. That's the dromotropic effect. The entire system just gets a chance to relax. But okay, here's where things get even more interesting. Just like a good mechanic has a whole toolbox of different wrenches, doctors have different kinds of beta blockers. Because it turns out not all brakes are created equal. Let's see how this incredible technology evolved.
I absolutely love this analogy, sledgehammer versus scalpel. The very first beta blockers were sledgehammers. They were non-selective. They blocked beta receptors everywhere, not just the B1 receptors in the heart, but also the B2 receptors in the lungs and other places. And this broad, powerful approach had some unintended side effects. That's what pushed science to develop a more precise tool, the selective beta blocker, a scalpel that could go in and primarily target only the B1 receptors in the heart.
And, this didn't just happen overnight. This whole process of refinement, of getting more precise for better results with fewer side effects, has actually happened over 3 distinct generations of these amazing drugs.
This table gives us a really nice snapshot of that evolution. You had first-gen drugs like propranolol, that was the original non-selective sledgehammer. Then came the second generation with drugs like atenolol. Those are the cardioselective scalpels that were designed to be much safer for the lungs. And then the third generation got even smarter with drugs like carvedilol that do more than one thing. They block beta receptors and they block alpha receptors to help relax blood vessels. Pretty clever, right?
So what are these sophisticated biological brakes actually used for? Well, the applications are just incredibly diverse and, frankly, life-saving. They're a cornerstone for helping patients survive a heart attack and for managing chronic heart failure. But they're also used for things you might never guess, like preventing migraines, treating essential tremor, and even controlling symptoms of an overactive thyroid. And just to really drive home the impact here, get a load of this number. For someone who's just had a heart attack, giving them a beta blocker can decrease their risk of dying by a staggering 25%. That's not a small difference. That is a massive, life-altering impact. But of course, any drug this powerful is gonna come with a warning label. I mean, we're talking about applying the brakes to a fundamental system in the body.
That's a serious intervention, and it's definitely not without its own risks and side effects. And if you think about it, the common side effects make a lot of sense, because you're literally slowing the whole system down. So patients might feel tired or dizzy, they can get cold hands and feet, and sometimes it can mess with their sleep. And if the dose is too high, the heart rate can actually get too slow, which is a condition called bradycardia. And this quote right here, this is exactly why that sledgehammer versus scalpel thing we talked about is so critical. Remember how those non-selective sledgehammers also hit the B2 receptors in the lungs? Well, for a patient with asthma or COPD, blocking those receptors can cause their airways to clamp down, to constrict, and that can be absolutely life-threatening. This is the real-world, high-stakes reason why developing that targeted, cardioselective scalpel was such a game-changer. So this brings us to a really important and, frankly, pretty scary question. We've talked about the side effects from a normal dose, but what happens in an overdose? What happens when the brakes aren't just applied, but they're slammed straight to the floor? The results are really, really severe. Blood pressure can plummet to dangerously low levels. The heart rate can slow to a crawl. And in the worst cases, it can trigger seizures, cause the person to stop breathing, and even lead to a coma. This is a true lights and sirens medical emergency. But the treatment for this is just fascinating. So after all the initial supportive care, doctors turned to a really surprising antidote, IV glucagon. And what's so genius about this is that glucagon stimulates the heart using a completely different pathway. It totally bypasses the blocked beta receptors. It's like finding a secret backdoor to get the heart's engine started again. In some cases, they'll also use high-dose insulin to just try and pour fuel into that struggling heart muscle. Now, hitting the brakes directly at the heart is a powerful strategy, but it's not the only one. There's another class of drugs that takes a completely different, and you could argue a more elegant approach. Instead of blocking the message way down at the finish line, they go straight to the source and just flip the off switch inside the brain itself. This slide breaks down the two strategies perfectly. Beta blockers, they work out on the front lines, intercepting signals way out in the body. Alpha agonists, on the other hand, they work in the command center. They go right into the brain and tell the entire sympathetic nervous system to simply send out fewer fight-or-flight signals to begin with. It's kind of the difference between building a dam versus just turning off the faucet. Let's look at two really important drugs from this class. You've got clonidine, which is incredibly versatile. It's used for everything from high blood pressure to easing the really difficult symptoms of substance withdrawal. And then you have methyldopa, which has a super specific, super important job. It's one of the main trusted drugs for safely managing high blood pressure during pregnancy. That's a situation where the safety of both the mother and the baby is just absolutely paramount.
So let's kind of zoom out for a second and put this all together. We've seen how our body's gas pedal can get stuck in the on position, and we've looked at two incredible pharmacological strategies for dealing with it: applying the brakes right at the heart with beta blockers and flipping the off switch up in the brain's command center with alpha agonists.
And all of this leads to one final, really exciting thought. These drugs, they represent a huge step forward for medicine, the ability to reach in and regulate our own internal systems with incredible precision. And it just makes you wonder, right? As our understanding of all these pathways gets deeper and deeper, how precisely will we be able to fine-tune our own biology in the future? What other switches and what other brake pedals are just waiting for us to discover?